Star Country 96.9 on a rainy Tuesday morning. Oh, Tuesday morning. That means we need a house call from the good doctor, Dr. Craig DeLisi, Family Care Center, Titus Regional Medical Center. Healthier Tomorrow start here. And here is Dr. DeLisi. Hello.
Good morning, Kerry.
Oh, you kind of sound like Barry White this morning.
Or Bowser from Sha-Na-Na.
Or Bowser from Sha-Na-Na. Right. You okay? What's going on, doctor?
No, just a little head cold my kid shared with me.
When you have kids, you will get sick. It's going to happen. Right. So when a doctor gets sick, do you see a doctor or do you self-diagnose?
I like to just kind of let things run their course unless I need help. And then
I gotcha.
I mean, sometimes I'll treat myself, but I do have a doctor.
You do. A doctor with a doctor. This is our first Tuesday chat of a brand new month, the month of June. So I took a peek at what this month is set aside to make us aware about in terms of our health. And Alzheimer's is an awareness that we are to be more cognizant about. So how does that affect you and your practice? Do you ever have a patient come in and have an early indication that maybe they're suffering from the early stages of Alzheimer's?
Yes, it happens quite often, honestly.
Really?
I think because, one is just the prevalence. Alzheimer's is very, very common. The incidence and, it's the most common form of dementia. And as people age, it is increasingly common. And so most people, or a high percentage of people at least, have been affected by it in one way or another, by family members that they know and or cared for, and so there's just a high level of awareness. So as people get older, and sometimes even when they're younger, if they start noticing memory deficits, I think that's a fear that a lot of people have. That it could be an early sign of it. So people do often come in saying, "Hey, I'm noticing this and this, and curious if I might have dementia." And I would say that the most important things for people to consider that can be signs of it are primarily a short-term memory loss. And, that's a classic symptom. And even when you meet Alzheimer's patients who are fairly advanced, when they're very advanced, I think at that point they're not remembering much of anything, including even who people are. But in earlier stages, they have great long-term memory. They can recall things from the past and their youth and childhood and years gone by with great clarity. But anything that has happened very recently, including the conversation you're in the middle of, they often will forget. And so I think that's an important sign. And then the other thing is also the family history. It does seem to be significantly hereditary. So if someone came in and said, "Hey, I'm noticing I'm forgetful, I'm forgetting where I put the keys or why I walked into a room," and different things like that. And then I'll dig down and just ask, has anyone in the family had dementia? And who was it? And how severe and what age? And if there's no history at all, that's pretty reassuring. It doesn't mean you can't develop it, but there's definitely a very strong genetic component. And the other thing I would say about Carrie is that a lot of people wonder about dementia or Alzheimer's when I just think they're having either normal, sort of age-related, mild memory loss, or even more common than that, is just forgetfulness because of distraction and lack of concentration. So I do think, because I experienced that myself, if I'm not resting well and taking care of myself, there's lots of things going on, and I'm in the middle of something and my mind is somewhere else, then you're not really retaining whatever that is, and then you'll forget what it was. And I mean, that happens, I think, to everyone, and so I do think that people need to realize that that's a common thing too, and especially for younger people. I mean, I've had people in their 20s and 30s thinking, "Okay, I'm pretty sure I have dementia now." Look into it.
I am glad you brought that last point up, because as somebody who is north of 60, I, from time to time, will walk into a room going, "Okay, now why did I walk into this room?
Yeah,
what
sure.
is
Same
going
here.
on?"
No, of course. I think that's pretty normative.
Yeah.
Now, with that said, if there are truly signs that people are very concerned or their concerns are legitimate and there's a family history, I do think getting evaluated by a neurologist sooner than later is helpful, because the medicines that currently exist to help Alzheimer's disease really don't do a lot to restore or reverse memory loss, but they do help preserve it. And so if you wait, and now it's significant and you can't perform a job anymore or whatever it might be, and then you start medicine, usually the improvement is hardly noticeable. But if someone finds it early and a neurologist says, hey, this looks and smells like Alzheimer's, which, by the way, is a clinical diagnosis. There's not a blood test. There's not a scan. Then they start on medication that could really help preserve function so that 5 years from now they're in a better place than they would have been if they weren't on it. So it is worth addressing and bringing up those concerns with your doctor for that reason alone, I'd say.
So if there is a Tuesday morning in which you call and I'm like, yeah, why are you calling me?
That's right.
Would you refer me to a neurologist?
We'll do a mini mental
screening
exam.
That is Dr. Craig DeLisi.
I'll ask you the names of the last 5 presidents and how to spell world backwards. Those are on the test.
Wow. WORLD. DLROW.
Very good.
I did it. Now, the 5 presidents, I think I could do that too. Oh, thank goodness. That is our Tuesday chat with Dr. Craig DeLisi. Feel better, by the way, buddy. Dr. Craig DeLisi joins us every Tuesday morning. He's with the Family Care Center at Titus Regional Medical Center. Healthier tomorrow. Start here.